Hi everyone, welcome back to Learn with MedNuggets. In today's video, we are going to talk about pre-renal failure. When it comes to renal failure, there are three types called pre-renal failure, intrarenal failure, and post-renal failure. Pre-renal failure, as the name suggests, is a problem that happens pre or before the kidneys, which causes it to fail. Intrarenal failure, as the name suggests, is a problem that happens intra or inside the kidneys, which causes it to fail. Post-renal failure, on the other hand, is a problem that happens post or after the kidneys, which causes it to fail. If you didn't understand that, let's take a simple example to explain this concept. Imagine you have a car that needs fuel to run. If you forget to fill up the gas tank, the car won't start, right? This is similar to pre-renal failure, where kidneys don't get enough blood to function properly. So this is not a problem inside the kidney, right? It's an external problem, something that occurs before reaching the kidney. Now let's say, while driving, you hit a big pothole and it damages the engine. Now the engine is still receiving fuel, but it can't run effectively because of the internal damage. This represents intrarenal failure, where the kidneys' tissues are harmed by infections, toxins, etc., preventing kidneys from filtering blood properly. Finally, imagine that after filling the gas tank and having a working engine, something clogs the exhaust pipe, like a blockage in the urinary tract. Even though the engine is fine and fuel is being delivered, the car can't function properly because the exhaust can't escape, right? This is similar to post-renal failure, where your kidneys are working fine, but a blockage prevents urine from flowing out and letting the kidneys do its job. With that said, now let's have a look at the causes of pre-renal failure. We already know that pre-renal failure occurs due to a reduction in blood flow to the kidneys. Now, what leads to a reduction in blood flow to the kidneys? This can happen in four ways. Either you are not taking enough fluids, meaning your fluid intake is low, or you're losing whatever you're taking in, or there's something going on in the blood vessels that transport blood or fluids, or there's something wrong with the pump which pumps blood to the entire body, or else everything is fine but the kidney is not receiving an adequate fluid volume because of an abnormal fluid accumulation in certain areas of the body. So now let's move on to the first scenario. Reduced fluid intake can happen due to dehydration and confusion, as confusion can impair a person's ability to recognize thirst, drink water, or even express their need for fluids. Reduced fluid intake is also common in patients we keep nil by mouth before and/or after a gastric surgery. So these are three things that can lead to a reduction in fluid intake. Now let's move on to fluid loss. You can lose fluid volume during vomiting and diarrhea. Medications such as diuretics that we use to treat volume overload can also lead to a loss of fluids from our body. Hyperglycemia can also lead to fluid loss, as when blood sugar levels are high, the kidneys try to remove the excess glucose from the blood by filtering it. Since glucose is an osmotically active substance, it will also pull water along with it. Excessive sweating, hemorrhage or direct blood loss, and burns can also cause fluid loss. When your skin gets burned, water can easily evaporate from the body, as the skin, which acts as a barrier to prevent fluid loss, is now compromised. If something is going on in the blood vessels, like for instance septic shock and cirrhosis can lead to a loss of fluid volume. In septic shock, bacteria release inflammatory mediators that damages the endothelial lining, causing them to become more permeable or leaky. As a result of that, fluid can leak out from the blood vessels into surrounding tissues. In cirrhosis, the resulting imbalance of vasoconstrictors and vasodilators can lead to fluid loss. Now let's move on to problems with the pump. Your heart pumps blood to the entire body. So problems with the heart, such as myocardial infarction, arrhythmias, cardiomyopathy, and cardiac tamponade, can weaken the heart and lead to heart failure or shock. This inability to pump blood effectively to vital organs of the body can lead to a reduction in blood flow to organs like your kidneys. Finally, let's move on to the third space losses. Third spacing refers to the abnormal accumulation of fluid in areas of the body where it's not easily accessible. This can happen in conditions like pancreatitis, peritonitis, and bowel obstruction, which can lead to a reduction in the blood flow to the kidneys. So, how do you diagnose prerenal failure in a patient? Well, there are a few parameters like serum BUN to creatinine ratio, fractional excretion of sodium, also known as FENa, and urine osmolality that can confirm that this is a prerenal failure we are dealing with. A serum BUN to creatinine ratio of more than 20, a FENa of less than 1%, and a urine osmolality of more than 500 indicates prerenal failure. Say what now? Let me break this down to you. When the blood flow to your kidneys reduces, your body's RAS pathway gets activated to help preserve fluid volume. Aldosterone gets activated, which reabsorbs water. Wherever water goes, sodium follows. So if this is your kidney tubule, aldosterone is going to pull as much as water out of this tubule. Sodium will follow water like its tail. So the urine produced is going to be concentrated and have less sodium in it. Thus, the fractional excretion of sodium will be low, it will be less than 1%. This is exactly what happens on a hot summer day when you're super dehydrated. Your urine is concentrated and bright yellow, isn't it? Since the urine is concentrated, the urine osmolality will be greater than 500. Our kidneys filter BUN and creatinine in the urine. Now, like sodium, there's another fan of water. That is BUN. Wherever water goes, BUN will also follow. Thus, the serum BUN to creatinine ratio will increase. So, how do you treat prerenal failure? We can treat it by replacing fluids with normal saline and correcting the underlying issue. Now remember, like I mentioned in the CKD video, over here the damage occurs in the kidney tubules, not the glomeruli. So acute renal failure is reversible with timely management. It's also important to manage the blood pressure in these patients, correct any electrolyte imbalances, and regularly monitor the kidney function, urine output, and vital signs to ensure that the kidneys are recovering and to adjust treatment as necessary. So that's prerenal failure, guys. This is a summary of everything I taught today in this video. Come back to this video and watch it again, because you might think you understood this completely, but let's be honest. Thanks for watching and have a great day.